I understand you have RSD, also known as complex regional pain syndrome.
Yes.
Okay. So fill us in on the story. How'd you got it?
I was running with my dogs up a hill, and I must have hit a patch of ice and woke up at the bottom of the hill and broke my left fibula. And since that time, they put it in a splint for a few weeks, put it in a cast several times because I was complaining of not feeling my toes, ice cold, and I always intuitively I knew something was wrong. It felt like it was more to this, and then it was actually a physical therapist that said you may have RSD and to get it checked out. So I saw several top doctors in Boston, and pretty much they just apologized to me for me getting this, and they said they didn't know what to do. They said 1 to 2% of people get this out of 7 billion people, and the best that they could do was try me on a trial of narcotics or nerve blockers, and I didn't want that. So I've been exploring outside the box, and I saw you on YouTube and know that you've been helping, so I'm pretty desperate.
Okay, I also understand that this is bad enough that you're in a wheelchair.
I was in a wheelchair for 6 months. I got out of the wheelchair about 3 to 4 weeks ago. I'm using crutches. I'm still in excruciating pain.
Where do you feel the most pain on this foot over here? Point to us.
Well, it's from my ankle down. It's the whole foot.
The whole time.
It's the whole foot. And I can't bend it. So I can't really, this is as much as I can wiggle my toes. I wasn't able to do that before. I can wiggle my toes, but that's about it. I can't, that's as much. And
so clearly range of motion is very limited.
Yeah. And I've been working with a physical therapist. I have 2 acupuncturists, energy healers. I'm doing everything that I can to get my foot back. And originally, I couldn't touch from my knee down. So I worked hard at desensitizing. It was literally like if I took a tissue, it was if somebody was taking a piece of glass. It was just so, I couldn't touch it. So
understood.
I've made some progress, but I'm still.
All right, so we're starting with instrumentation. And we're going to look for that abnormal temperature due to inflammation. And we found one at this level. All right, so we feel there's swelling right here. Right. And we're going to be gentle here because with RSD, usually everything is just inflamed and just sensitive right here. So now let's take a look. How's that feel right there?
Ooh.
Yep, understood. So that's your 5 over here. How does it feel right there?
Okay. Oh gosh.
Yeah, that's what I'm saying. I just did very, very gentle. That's your 4. That's lighting up. All right. So this one is not too bad on the 5. We're gonna be very gentle on how we assess this. So the 5 is actually moving pretty decent. But the 4, whoops, I'm sorry about that. Yeah, that's how inflamed and tender this is right now. Okay, right there. See, it's not moving whatsoever. It's stuck. So number 4 is the one we need to address.
We have 2 basic nerve systems. One is sympathetics, acts like a gas pedal, makes things go faster. And with parasympathetics, acts like a brake pedal, supposed to slow things down. Now, it's no different from like touching a hot stove. What does our body do? We're supposed to go hot, right? But unless there's some kind of interference to that nerve and it causes a short circuit, in essence, what RSD is no different from like saying like you touch a hot stove and you keep on doing like this. You have no choice but to keep on doing this. And it's a vicious cycle that keeps on feeding itself. So in your case, this nerve all straight down to this foot over here, this gas pedal, it keeps on running as if there's a huge rock that's just stuck on the gas pedal and it's pressed all the way down. So no matter how much you slam on the brake pedal, no, it still keeps on running, right? So we already identified there's a problem at that particular level right there. We need to address that, right? Take that pressure off the nerve, allow the sympathetic nerves to calm down, right? And then you'll start noticing the foot over there will start calming down as well. Right? So what I identified and we tested and confirmed on you, right? This fourth lumbar, that's the one in trouble, that's the one we need to correct. So this is the lateral foot.
And as we can see over here, this is what normal is supposed to look like. We want to see these kind of cortices, right? We're talking like the bone density. Same thing over here. It's supposed to be nice and strong, right? Nice, solid on the white as well. What I don't want to see is, we see all these trabecular patterns over here. So when you had the active RSD, it just took all this calcium out of it. The reason why is because your body was trying to put out this major forest fire over here. Calcium is an excellent fire extinguisher. Only problem is it's just going to make it very brittle. So right now, looks like there is no serious degenerative or that situation. So we're past the acute stage, but this is subacute. So right now, okay, we have to resolve that nerve dysfunction so your body can start depositing calcium back into here. And also, it goes without saying, we're not going to correct this foot. We don't want to cause a fracture in there whatsoever. We got to go address the root cause of it. So this is subacute, right? Did you just recently ice this or no?
No.
Okay. Because usually when it's active, this is like scorching hot.
Right.
Right now it feels cool to the touch, so this is subacute. This is good.
Okay.
Right, so now
It goes from one extreme to the other. It gets really hot and sweaty, and then it gets cold as ice.
I understand that. So that's what we call subacute. Can you relax this? Hello.
Oh.
That's it. Super gentle. Okay, come on up.
Oh.
Okay. Go ahead and walk around, please.
Can I use this? Or?
Well, you tell me.
Okay. It's a little better. Oh gosh. Oh wow. It's better. It still hurts, but not as much. Yeah. Oh God. Thank you.
Oh, you're welcome.
Do you need to do it again?
No, we don't need to do it again.
Oh my gosh.
Okay. No, this is all we're gonna do for today's visit, but
Okay.
fill us in. What's going on with that foot? Why don't you have a seat? I know it's still a little uncomfortable.
It doesn't. It's not as intense. The pain isn't as intense.
Well, we can also see the color of it too.
The color's a little bit better. I'm wiggling my toes more. It doesn't hurt as much. Wow, it's wonderful.
Yeah. That's why it's so key to make sure to restore that nerve function to it. Right? Like I said, we just took that gas, just took that huge rock with that gas pedal there.
Yeah. Wow.
So how much of a difference would you say that foot right now?
I don't know. Can I walk with that?
Sure.
Wow, it feels so different. It's lighter. Oh, wow, it's amazing. I'm even bending it a little bit. I couldn't bend it like it was stuck at a 90 degree, and I'm bending it a little bit more.
Okay.
I don't feel like I'm on like a peg leg. Yeah, it's great. You see the difference? It's wonderful.
Okay.
Oh, I want to run. I can't do that yet, but it's wonderful.
Well, don't start running now.
No, yeah, not
All
yet.
right. So here's what you need to do. Okay. So we didn't get that on film, but I want to also tell the viewers as well, for any other RSD patients out there, or CPRS, I'm sorry, the complex regional pain syndrome patients, whatever you do, you don't ice or heat, your wrist, your hand, or whatever that's affected by the RSD. The reason why, because you're gonna feed that vicious cycle. Okay, and it's just gonna amplify it even more.
Yeah, I've been icing for 6 months.
Right. Well, that's not exactly the right answer to that.
Right.
If anything, you ice here.
Okay.
So this is actually what I want you to do. So that forked lumbar, that's what we corrected. We took that nerve pressure off of it. I need to ice here, not there,
Okay.
not the foot.
Okay.
And don't, otherwise you'll kickstart it up again.
Okay. No, I'm gonna do
You
it.
have to ice only the low back.
Okay.
Because that's where all your swelling is.
Okay.
But very gentle too. Don't go too crazy on it. I want you to wrap it with a very thick towel, right? And do it only for about roughly 10 minutes. Start 10 minutes first, okay, 5 to 10 minutes. If you start to feel it
fire up again, you need to discontinue right away.
Okay.
So I just want a little brief, just to get some swelling, get more pressure off those nerves.
Okay.
All right.
Yeah.
All right.
Now, will I be able to bend it? Is it?
It's going to take time because right now, right? Because remember, your body's been hitting that gas pedal for so long, so all the swelling's in there.
Right.
It's going to take at least 1 to 2 days for your body to pump all that swelling out of there.
Okay.
So when you sleep during tonight, please elevate it.
Okay.
Bingo.
Okay. Wonderful. I'm so grateful. Thank you so much.
Oh, you're very welcome.
Thank you. Thank you. Oh, it was worth the trip.
You bet.
Thank you.